Chest pain or tightness can be a warning sign of blocked heart arteries. When blood flow to the heart is restricted, immediate medical care is critical. Angioplasty is a minimally invasive procedure that opens blocked arteries and restores healthy blood flow. Doctors begin by evaluating the heart's electrical activity. Imaging identifies the exact location of the blockage. The cardiologist carefully explains how angioplasty can restore blood flow. After understanding the benefits and risks, the patient agrees to the procedure. A stent is a tiny mesh tube that keeps the artery open after treatment. The procedure takes place in a specialized cardiac catheterization laboratory. The access site is cleaned and sterilized to prevent infection. Local anesthesia numbs the area, so the procedure is comfortable. A thin catheter is gently inserted into the artery. The catheter travels through blood vessels toward the heart. A special dye highlights the blocked artery. The blockage is located precisely. A guide wire crosses the blocked segment. A tiny balloon is positioned inside the blockage. The balloon will compress plaque against the artery wall. The balloon inflates to widen the artery. Blood flow improves immediately. A stent is positioned at the treated area. The stent expands and locks into place. The stent keeps the artery open permanently. The balloon is removed while the stent remains. Doctors confirm restored circulation. The catheter is removed safely. A pressure bandage prevents bleeding. The entire procedure often takes less than 2 hours. Doctors monitor the patient closely after the procedure. Most patients begin gentle movement within hours. Imaging confirms successful treatment. Angioplasty can relieve chest pain and reduce heart attack risk. Recovery is often quick compared to open surgery. Healthy habits help protect the heart after treatment. Many patients return home within a day. Restored blood flow allows people to regain energy and mobility. Angioplasty with stent placement has saved millions of lives. From blockage to healthy flow, modern medicine makes recovery possible. This video is for educational purposes only. Always consult a qualified cardiologist if you experience